are back, and we begin with the main and the important component of our summit, that is the panel discussion. And now what we are going to have is a pre-inaugural panel discussion for the day. And the topic is the changing face of public health. And we would be talking a lot on challenges in forming a structure both in public health and specialist cadre, private players to play a more important role, CSR can become more meaningful, how digital health can support public health in India and where we stand, creating future-ready health workforce challengers and facilitators, role of medical colleges in public health cadre and existing teaching faculty and training newly commissioned cadre. To have this panel discussion, may I call upon Dr. Nagari Birappa, Director, Nizam Institute of Medical Sciences, Hyderabad, which is one of the premier government institute of Telangana. Sir would be moderating the panel discussion for us. Can I hear a few applause for our moderator here, please? Further, I would like to call upon Dr. Anuradha Medoju, Senior Regional Director, Telangana and Andhra Pradesh, Ministry of Health and Family Welfare, Government of India. Further, I would like to call upon Dr. K.V. Ramana Reddy, Dean, Malareddy Dental College for Women, Hyderabad. We have us joining Shri Sharat Anand Jupali, Managing Director, Shivam Medisoft Services, Hyderabad. And we have Major Dr. Ashlesha Taude Kelkar, Consultant Digital Health, Maharashtra University of Medical Sciences, and she has come from all the way from Mumbai and who has already served the armed forces. Can we hear applauses for Dr. Ashlesha, please? And then finally, we have Dr. Ashutosh Biswas, Director, All India Institute of Medical Sciences, Bhubaneswar, Odisha, joining us virtually.
Good morning. Let me thank the IndiGlobal Summit for giving me this opportunity. Basically, I'm a surgeon. I'm a surgical gastroenterologist. Became an administrator a few months back. All these days, I spent in an operation theater. Now I have come out of the shell and seeing public health. You can understand my knowledge about the public health. A man who has confined to the operation theater and now looking at a global, at a Telangana, how the public health system is, trying to learn, would like to put some challenges which are facing by the public health system in order to retain them, in order to maintain the public health system and to get the doctors in a public health system. It's not an easy task. Well, I made few slides trying to explain, as far as my knowledge goes, how difficult it is to maintain, to retain, and to build infrastructure in the public health systems like PHCs, district hospitals, and tertiary care center. I'm working for a tertiary care center, so I know the difficulties in tertiary care center, but let me also see how difficult it is to maintain public health system also. I'm sure the entire country, entire world was definitely looking very interestingly, anxiously, difficulties of the public health system, more so after COVID pandemic. There were programs, I'm not saying that there are no programs. There were many programs, national programs. However, after pandemic, things have changed. The hospitals which did not have an oxygen, now all the beds have oxygen pipelines. There were no specialists, but now, yes, we have a specialist. There were no super specialists, now we have a super specialist. There were no ventilators. You have seen how many patients dying of not having any ventilators, simple not having an oxygen. But the today's scenario, after 2 years, it's completely changed. There's a lot of awareness among the public, a lot of awareness among the governments So it's now, I think, settling. That dust is settling. So we know the certain frameworks in public health. We know that the specialist cadres, these are the doctors who are done an MBBS, who have done a specialization. These are all specialist cadres. They may be a general surgeon, pediatrician, orthopedician, and other basic surgical group, including physicians. The public health cadre, the working in PHCs and CHCs, block hospitals, they're all the basic MBBS guys, probably with some healthcare management or those who have done a P&SM. And we have a health management cadre. I think this cadre is very important. The government institutions lack this kind of a cadre. However, the corporate system has health cadre management like, financier, HRs, or people who have done a Master of Health courses, and teaching cadre like medical colleges, faculty in medical colleges. So these are all, the framework of any hospitals. Government. Essential core principles are public health care cadre, which consists of public health professionals. As I said, they may have an MBBS with P&SM. Health management cadre, these are the people who are, I think most of here are from this group. And specialists, as I said, they are orthopedicians, maybe medicine, maybe surgical specialty cadre, and teaching cadre as per the NMC guidelines. The career progression for each cadre, what I mean to say is, the person who has done MBBS should have a career opportunities so that they can work well in certain group of hospitals. The existing GDMOs with 3 years of experience, and they should also have master course in public health. The special pay for an extra qualification, yes, this is a very important. A person after a few years might do an extra qualification. There have to be some incentive. There has to be some special incentive for those for an extra qualification. And specialist and super specialist join this to help the specialist grade. The desired principles, the incentive scheme, it's very, very important to motivate the public health courses so that, the continued education, it helps, it gives a lot of boost to the professionals so that they stick on to primary health care center or district health care center or tertiary health care centers. District Health Society helps definitely in convergence between public health and clinical function. This is very important. It's a government work. And method of recruitment, we need to definitely identify the number of posts and recruit as and when necessary. Initiate urgent time-bound actions is most important by the government or any other cadre. So way forward for the states is a stepwise implementation of the plan, mapping of the existing public health personnel, making structure based on IPHS norms in existing facilities, and so on, so on. So what are the challenges? Resource constraints. I am sure these are the problems any government will face. But now the government of Telangana has really changed the dynamics of the healthcare in state of Telangana. It's mainly because of our Honorable Chief Minister and our Honorable Health Minister, sir. They have really changed the dynamics of the healthcare system in Telangana state. The resources constraints have been cut down. So there were a lot of financial resources have been pumped in the infrastructure development and human resource management. Manpower shortages, yes, they are, but it's been planned to encourage, it's been planned to organize all this. Infrastructure deficits have been corrected. If not, one has to really look into all these kind of things. Coordination and collaboration with other organizations is most important. Rural and urban division. So if you see, the urban hospitals might be very well equipped, whereas rural may not be equipped well. So it's the time now to upgrade all the rural hospitals so that there's no division between these two. Policy implementation and governance is also crucial role in establishing a robust structure in public health. I think this is, we have realized during pandemic, COVID pandemic. So we need to upgrade all these things. Policy gaps, if there needs a lot of discussion, and bureaucratic hurdles needs to be tackled and so that there is a better coordination. Strengthening the governing structures is very important, and so we need to address these challenges, which requires multi-pronged approach involving adequate investment in healthcare, improving infrastructure, expanding the healthcare workforce, promoting interdisciplinary collaboration, enhancing training programs, and strengthening policy implementation and governance mechanisms. So inadequate infrastructure, as I said, in rural areas, this definitely includes healthcare facilities, diagnostic center. I am very sure that government of Telangana is doing extraordinary work in this creating an infrastructure all over the state. The funding, absolutely no issue with the funding, but if any government needs to fund for any resourcing constraint, I think this is the time. Health disparities, as I said, between a rural and urban needs to fill that gap, and referral system should be strengthened. Limited public health workforce, yes, there definitely need to be looked into, especially epidemiologists, public health managers, health educators. It's not the treatment, prevention is also very, very important. Health information system, all these things needs to be computerized so that even a person in a tertiary care center need to look at what's exactly happening at public health centers. The awareness is the most important, and behavioral changes. And specialist cadre challenges, yes, this is the biggest challenge. Retaining specialists in any hospital is the biggest challenge, including a super specialist. So we need to really look into this, incentivize so that people can stay in a public sector. Training and continuing education. One need to train. One need to undergo continuous medical education so that their knowledge is upgraded each and every time. So overburdened hospitals, yes, of late we've been seeing there's a lot of importance given for public hospitals, public health care, and that's the reason why there's a confidence build-up amongst the population, and they are reaching the government hospitals very much now. In fact, my hospital right now, I have 1,500 bedded. Now I have patients, 1508 patients. You can understand the workload in a tertiary care center. The hierarchical structure needs to be maintained. Yes, urban-rural disparity should be cut down. Private versus public sector imbalance. Yes, we have to have sometimes PPP and career incentives. As I said, brain drain. People are going after MBBS to other countries because of better facilities for them. I think this is a very important. One needs to look into why our people are going to other countries and serving. So we need to create facilities. We need to create incentives. We need to create facilities for all of them so that they can stay in our country and then treat the poor patients. So some of the challenges to address: policy reforms, increased investment in healthcare infrastructure, targeted recruitment and training programs, enhanced intersectoral collaboration, and other measures needs to be taken. Thank you very much. May I call upon Dr. K.V. Ramana Reddy Garu? He is also a surgeon, so they have a relation between a surgeons. So I request Ramana Reddy Garu to say a few words.
Good morning, one and all. There's a disclaimer here, as Dr. Birappa said, I'm also a maxillofacial surgeon. Being in the administration for a very long time, public health, I feel, plays a very, very important role. As surgeons, we are overwhelmed and we are very passionate about delivering the services, but there's a limitation to amount of services which we can deliver at the tertiary care centers. So this message is basically for most of the students who are here, is the role of what public health can do. And we have typically seen during COVID, whether it is a vaccination or whatever, you have to be at the top in the pyramid trying to deliver the appropriate health care. So 3 issues are what will affect any individual, what we are looking in a society. One is health, other is education, other is housing. So health is a very important priority. So the onus is on us to how we are delivering it, where it is affordable, accessible, and where we are providing accountable health services. So we have the onus is on us. And again, a message is a lot of students are actually looking at public health, at going abroad and pursuing this education. My message is, no, Indian problems are Indian problems. We don't want Western ideas or solutions for us. We actually have to devise and look into our problems and come up with our own solutions so that, what works for us. So this is an important area where we need to look into it. And after being for about 30 years in the profession, if I have to choose another profession, I would go back and do public health. That is the message which I have. Thank you very much.
Thank you, sir. Can I ask Anuradha ma'am your views on change of face of public health?
So thank you so much. First, I would like to congratulate Global Health Summit, all the organizers, and asked us to participate here to exchange our ideas, what we are doing in the state of Andhra Pradesh, in Telangana, with other states, with extreme, the guests which they are here from Assam, Jammu and Kashmir. I'm so happy to be here. And today we are discussing about the challenges in the public health management. What are the challenges we are facing? Why we made it, this cadre to be implemented in our country? In 2000, we know very well, during the COVID, that's a new strain, new virus, no one knows about it. We handled MERS corona and SARS coronavirus also before, but to India, it's a major challenge. But as per the government of India guidelines, the total country and all our states, we become one. We could able to manage the COVID in such a, within 24 hours, we have implemented in the port of entry, because I'm taking care of Chief of Airport Health Organization to Hyderabad, Tirupati, Vijayawada. Within 24 hours, anyone who is coming from China, that time it was started in Wuhan city, so from the China and the other, Singapore, the only two countries were there. But we have stopped at that time. Our public health system, we never know about such a crisis happens to us, but it's an emergency. All of us together, and then we worked. Here, not only the administration, not only the technical field, even the community participation also there. This has a major role. So we all together, we know about the COVID vaccination, and almost everyone, we, without any force or anything, we voluntarily, we have come forward and then we got it vaccinated. So this motivation, it is from the public and the private sector and the community participation. So this is a successful story of our India, our country, as compared to the developed countries. You know very well, the mortality, it's not much in India as compared to the other countries. So this is the one, it's a strength of our country, we can do anything. So on this line only, for every diseases, not only during the emergency, for every disease, we are concentrating on the treatment mode. Always clinical management, clinical treatment. But the public health is the one. If the community awareness is there, we can prevent the disease. So with this agenda, and then in 2020, you know very well, and then this a management, how can it be public health cadre management? Is it possible, public health means, is it possible only with a doctor only? Without a praja, without the society communication, can we take forward that whatever we put our projects, can we put and then can we force the society? So much ethics are there for that. The tribal people are there, hilly regions are there. So different people have a different cultures. Even to, according to that, we have to frame, we have to give an awareness to them. And then we have to do it how the public health awareness should come. This is the way, it's not only a doctors, equally we are all responsible. The COVID has taught us, everyone, from the politicians to the executives and public, everyone, we all participated together. So it's a successful program. So we wish all the national health programs in an emergencies also, along with. So we should have a unity. Maybe we are different expertises in different fields, but we all come together, we can win it. So this cadre, when we say, yes, sir, as said, there are the challenges are there. Because the government of India has rolled out, and then at least by 2026 is the one to give it to the states, to roll it out by 2026. That a lot of challenges, you know very well. To make one cadre, it's not an easy thing. Because the cadre itself, and then until now, and there is a, as sir said, there is a primary health care and secondary health care and the tertiary care. But now the fourth one, it is coming too. There are a lot of questions in our medical professionals. But this is the platform where we can take it. Even other people can read the public health. I mean, they can study the public health. What we need is public health institutions. Now, we know very well public health institutions means only few institutions are giving the public health, the education, post-graduations. And as the MBBS doctors, they know about the community medicine, which is no one likes also. Because during the MBBS graduates, which is a relaxing posting means, it's a community medicine. Because they can go to the villages, they can relax, they can go in buses, and then they can come back. So that's the way, but that's not the importance they know that time. I'm not denying it, but when we are in the medicine, we will think that so community के जाना है, बस देखना है आ रहा है, तो ये एक relaxing part की जैसा हो गया. लेकिन उसमें जो है जब public health में अभी मैंने काम कर रही हूँ, मुझे उसका जो importance है अभी पता चल रही. And the second one, administration. Yes, I do agree. The medical profession is such a profession which is a long duration profession. From intermediate onwards, you must be knowing, I don't want to name the institutions, रखता है 10+2 के बाद पढ़ो 18 घंटे पढ़ते हैं. उसके बाद MBBS का सीट मिलता है. उसके बाद it's not easy to pass the, because every textbook, it must be this much. And then they have to read for 16 to 18 hours for every subject they have to read. That keep it in mind. So together, 15 subjects, when they pass it out, the 15 subjects, they'll have a medical graduation degree. They doesn't know the parents kahan par hai, teachers, बस स्टूडेंट गुरु और शिष्या का रिलेशनशिप है और कुछ नहीं है, जो दुनिया के बारे में कुछ भी पता नहीं है. तो ऐसे ही हम लोग MBBS पढ़ते हैं. उसके बाद पोस्ट ग्रेजुएशन के लिए लड़ाई फिर शुरू, फिर बुक्स पकड़ो 18 घंटे पढ़ते हैं. एंड देन उसके बाद स्पेशलिटी होते हैं. स्पेशलिटी के बाद अगेन फॉर द सुपर स्पेशलिटी, यू नो वेरी वेल, एंड हाउ मेनी सीट्स आर देयर. Like the esteemed guest now sir said, as a surgical gastroenterologist, because they are more oriented on the technical side, how I can support to my public, how can I save the other life. This is the only the thing that is there in my mind, in their mind. But there are no administration. कैसे करना है, किसी को कैसे बोलना है, ये administrative training तो है ही नहीं है. After coming to the job and learning the administrative skills. Sir, I think for this, we need from the graduation side, the people, we have to develop the medicos or the super specialty or the specialist doctors as a leadership and administration. What we need for the hour, we are technically expert, because we don't have a communication skills. हम लोग पेशेंट के साथ तो बहुत अच्छा बात करते हैं, लेकिन कोलिग के साथ हम लोग उतना अच्छा नहीं बात कर सकते, because we think that it's a waste of talk. Because technically we think that because what I have to say to my patient, that much only will restrict. And the second one, socially, when we are in the outside, पता नहीं क्या है, everyone enjoys. But do you see any doctor is enjoying in the public? No. They think that दे आर ऑक्यूपाइड. अरे मैंने ये करने थे, ये डांस करने से मुझे कोई मतलब समवन कैचेस ऑन माय ऑन सोशल मीडिया एंड देन उसको कुछ करेगा. और कुछ मैंने कुछ पीना है एंड देन दैट टाइम आल्सो इट इज रेस्ट्रिक्टेड बिकॉज आई हैव टू टीच. किसी को ड्रग एडिक्शन के लिए बात करना है तो मैंने कुछ नहीं कर सकती हूँ. दिस इज द रियल प्रॉब्लम द स्टूडेंट्स आर फेसिंग एंड द डॉक्टर्स आर फेसिंग. So I think they are also human beings. They should express. We have to encourage the administration and the leadership qualities from the medical side only. We have to encourage. हमारा leadership कहाँ पर दिखते हैं पता है? जहाँ पर वो लोगों का injustice होता है, stipend कम मिलता है, तो उस टाइम हमारा leaders बाहर आते हैं. Then after that we never see our leaders at all. So I think this is the right time to make an administrators as a leadership qualities to develop, even in our medical field. That's a mandatory to us because ultimately the technical people can give and correct advice to the society and to the public, as in during the COVID, how we have done, even for the oxygen ventilators, and then whatever, even the guidelines, and then how the survey has to be created. So these are all important. So what we feel is now this system, integrated approach, holistic approach between the there is no difference between the any cadre. We are all humans. So with this humanity, we have to work together. The challenges, yes, it will be there. The different cadres are there. So how, if I absorb into that cadre, what is my position tomorrow, whether I'll get promotions or not, whether I may be posted in the districts. So these are the challenges are there. But in spite of that, because this is an integrated way of approach to the public health, it will be successful to our country and to our states. Already the states are doing the work. I hope by 2026 we are thinking, but before that only, altogether, because community awareness, community participation, it can be done by the social mobilization, by the social volunteers. Number 2, NGO organizations. Number 3, and any of the other departments. The health solely can't do it. It may be a women and child development, or it may be an industrial development, or it may be the small scale industries. So all together, all the ministries together, all the people together, we can work, and then these are the challenges, yes, but we have to adopt our own ethics, and then depending on the local, what we need it, according to that we have to frame it. And I think by 2025, our Telangana is a Bangaru Telangana, so we will not take even 2026. By 2023 or 24, definitely the roadmap can be formed. So thank you, sir, thank you.
Thank you, madam. You brought out very important points, how the medical students will struggle, to pass exams and to get a postgraduate seats and super specialty. It's really, very, very hardworking, and of late it's become more tougher to get any seats. Thank you very much, madam, for enlightening all those things. Thank you very much. Then let's move on to another speaker, Sharath Anand Juppalli garu, please.
Good morning, everyone. We'll be talking about digitalization in healthcare. I represent a software company, so I'm more or less the technical part, I'll say. In healthcare, basically, there are 3 participants. One, the patient who takes the treatment. One, the doctors and nurses and all who give the treatment. Third is the policymakers who drive the entire system. I feel how exactly now that in the COVID period, we have seen teleconsultations coming in. Now in India, what we see for public healthcare from technology perspective is patients are too many, reach is not complete, and the care providers are limited. There are limited number of care providers, which government is of course taking care of increasing more and more. But India is a vast country, so where the digital health comes in is each patient can be treated via teleconsultations. We have seen ICU, tele-ICUs are there. We have seen tele-radiologies are there. So what happens, the travel time reduces, the response time increases, and the treatments can be done at the remote level itself, and the expertise can be done given centrally. Second part, the treatment part is inbound hospitals and outbound outside hospitals. Inside hospitals, how digitization helps us, you have EHRs, EMRs, which are part of healthcare. Those are so capable, they can make medication charts out of it. They can prompt the nurses, ki by 12 o'clock, these are the medications supposed to be given to so-and-so patients. Same thing can be done for outpatients, where I am at home, I know what medication to be taken, and the technology tells ki boss, this is the time you take this particular medicine. Even the compliance can be done. Policymakers, if the digital data is available in the system, policymakers can predict ki, oh, that outbreak is going to happen in so-and-so particular place. That particular thing is going to happen. They can move resources, they can move things over there. So digitalization can play a huge, huge role. The way we are seeing ABDM coming, the way we are seeing National Digital Health Mission coming, we are dealing mostly with private hospitals, so all are getting compliant with milestone 1, milestone 2, milestone 3. Now where an Aadhaar number is generated for each patient, which is linked with the Aadhaar card. So slowly I am seeing next 4 or 5 years, entire health records will come into a central repository. We are visualizing as like we have RTO app, your vehicles, everything is in one particular app. The same, you will be getting a healthcare data also, your reports, your things, and all the hospitals are going to be centralized is what exactly we are seeing there. Thank you, Doctor.
Thank you, sir. We at Nizam Institute of Medical Sciences has an HMI system, and all the reports are integrated, and we send the reports to the patient on WhatsApp. They need not to collect. So as I said rightly, digitalization is very, very important. At the end of the day, we get good statistics. We know how many patients had a cardiac problem. We know how many patients had a stroke, and accordingly, preventive measures can be taken up. So epidemiology is most important. If I want to know the state of cancer stomach in the state, yes, definitely we need to have a digitalization of the entire system. The government of Telangana is looking for a digitalization of all the hospitals in the state. Thank you, sir. Let's move on to another speaker, Madam Taude Kelkar. Madam, need your comments.
Namaskar. Good morning to all. Good morning to the panelists, respected. It has been an enriching, really discussion and experience from everybody. I am in the practice of public health currently. I work in the Rural Health Training Center and tribal villages in Maharashtra. What is the role of these medical colleges when it comes to the cadre, public health cadre? And when we say that there are resources which are constrained, what do we really mean by that? What are the challenges first of all, and how do we really overcome on ground? First of all, of course, the medical colleges to be a part of this public health system is already being implemented from the government side. So medical colleges have an existing infrastructure, an existing set of teachers, trainers, a particular modules, which can be utilized for the, not just for the cadre, but also, sir, when we are talking about the primary health center or sub-center or community health center, CHCs, we are not really talking about specialists or even MBBS doctors. Here, we run the show with the help of community health workers. Community health workers are ASHAs, Anganwadi workers. And these were, as we all know, these were the soldiers. I am a soldier, I have come from armed forces. These were the soldiers during COVID. It was not us, not exactly the doctors, because in fact, doctors were not allowed in the community. The villagers were not letting them come inside from the hospitals. It was these people, it was those Ashas, Anganwadi workers, and ANMs, auxiliary nurse midwives. These are the people who are actually working on ground. There is one more post. I don't know how many people know about this. This is a CHO, Community Health Officer, who need not be an MBBS, who can be from allied health sciences, who can be from nursing, and MANS a sub-center. I am very proud to say that in India, rural healthcare delivery system is one of the strongest. One of the strongest healthcare delivery system. We do not find such system even in developed countries. But what is the challenge here? Like sir mentioned, yes, challenges are many. We are going to digital age. I'm also working with digital. So we think that if we are in the rural, we don't want to talk about technology. If we are talking of technology, we are talking of cancers and super specialties. No. Digital health is one, but digital public health is what we are looking at. India is the most populous country today. Is that a blessing? Is that our problem? What is it? It is upon us to decide. The most populous country and one of the youngest country across the globe. It is our strength. India is the most populous country. We have the most critical of the resources, that is the manpower. Today, we have the manpower, the young minds. What is required is training them correctly. So if I'm coming from a rural background and I'm looking at rural healthcare, it does not mean I leave aside the technology. Public health technology is where we are heading. Like sir mentioned, Aadhaar card. Few of us know about it. Some of us have it already. But in due course of time, I'm sure everyone will be having this. Everyone will be talking about this. This is one of our visions and we are working towards. The role when it comes to teaching faculty, this is where we are supposed to concentrate, not making super specialities, but training the community health workers, the nursing staff, because when it comes to telehealth or telemedicine in the rural, a super specialist, maybe a neurologist, will not go there and operate. But a nurse who identifies a stroke early and refers the patient to a hospital fastest with the help of infrastructure will be able to save that one person. At the same time, there has to be awareness. So, awareness in the community. And there the digital health will help, even in the rural. We have approximately 8.9% or more population, which is tribal population. This much population, which is available to us, which is part of us, unless this comes in mainstream, we are disabled. Apache hai. 104 million people. When we talk of India, it is numbers, sheer numbers. These are not burden. These are the strength of our country. This is the real strength of our country if trained, channelized in a proper way. For which, like Madam mentioned, there have to be institutions for training. And not just super speciality or apex institutes, but also training institutes for the lower rank of healthcare workers at every stage. At every stage. there is something that they say that, how do we really create a future-ready workforce, health workforce? What is future? What is ready? What is force? What is the future that we are looking at? Is it only digital? Is there any human interface? Is technology going to replace us, doctors? Many of us are really scared. General practitioners say patient chat GPT, Google लेकर आ जाता है diagnosis, he will ask us हमको ये वाला investigation करके दीजिए और ये वाला दवाई दे दीजिए. No, technology can never really replace a human interface. It can augment, it can assist. When we say of, future-ready workforce, it is everybody included, not just urban, not even only rural, which is the 70% of our, 60 to 70% of our population. Not only them, not just tribal, all together. Like how much diversity we have in our country, all of us going forward into future together, matching our steps. It has to be at one pace. It is not only the technology. Technology everywhere. Advanced countries have advanced technologies. We too have technology. What makes us cut above the rest? It is the ethics, governance, if that is being maintained and that again being taught. Ethics, governance, technology without ethics is a vice. It is a monster if not handled with governance, with care and ethically. And that is how the governance part, the management of public health has to be at the very basic of our training. The public health training, the community medicine or preventive social medicine that we talk about is changing. Last few years we have seen NMC has given so many beautiful changes to the medical, paramedical curricula. We adopt families in the villages. The students go to these families and interact. What are they doing? They're not using technology. They are creating human bonds. These human bonds will make them rooted, keep them rooted, and make them stronger. Technology can only assist, make it better. But at the basis of it is human to human relation. And that is how, as Indians, we all are together. It is the ethics and governance that we are talking about in digital health that will bring us all together. We are considered, across the world, we are, as Indians, we are considered, law-abiding, good citizens, generally not going the wrong way. This kind of behavior is not just a perception. It comes from our roots. While we are going up and advancing and going to become the global power in few years, not forgetting our roots is the key to stay strong, to stay cohesive, to stay together as one. Like Madam mentioned, like Sir mentioned, we have diversities, we have various other problems, but being together, being one, and being right is our strength. I think when we put this kind of training, this grilling in our young generation, upcoming generation of public health and all the healthcare cadres, we can achieve what we are looking at India as the global leader. Thank you.
Thank you. Thank you, madam. You brought out very important points. One is the digitalization, complementing or accepting the IAS and tertiary care center people. And ethics, one important thing you brought out, ethics. That's a very, very important things. More than digitalization, ethics is, I think one should really follow ethics. Thank you very much, madam. I think Dr. Biswas is waiting. Can you have is he available?
Sir, ma'am, you have touched upon the ethics. Ethics is the one, it's not only for the medical fraternity. What I feel, to whomever would like to come, our younger generation would like to come to the public health, the first they should have a humanity in their hearts. I want to serve to my society. I want to serve to my nation and to my world. So when that it comes to into their mind, even though they are in a different fields, it's not a doctor or the nurse has to do it. Everyone should have a humanity. Once that human touch and ethics are there, definitely the public health, because I'm living in the world of TB. Tomorrow I may get it, my mother may get it, or my child may get it. If we have that apprehension, definitely we will take all measures. So I think in all the professions, all the youngsters who are going to come into this cadre, so I request on this platform, you should have an empathy, you should have a humanity, you have a touch to the feelings. And then it's a prevention. Because for the clinical management, yes, patient acha hua, theek nahi hua, there is something you can put a bar. But for the prevention, there is no bar. And then your heart itself, and then it has to see. So I would like to add upon. Thank you.
Yeah, can I ask Dr. Viswas to speak on his views on changing face of public health?
Yes, sir. Good morning to all of you, sir.
Yeah, good morning. Can you go ahead? You can go ahead, please. Please go ahead.
Respected chairperson and the other dignitaries on the panel. I am extremely sorry and I apology for not being there in person due to some unavoidable situations in our institute. First of all, I'd like to thank the organizers, IndiGlobal, for inviting me in this very special second Health Care Summit. So just all the speakers, I think, covered almost the important themes that I'm going to just a few comments on the digital health, public health. What is the scope of digital in the public health and different institutions? Being the tertiary care hospital, the AIMS here in Bhubaneswar, sir, what exactly were this? I will go for a quick, probably a overview on that. So, if you talk about the sector, health industry, now digitalization of the health system is a very important. Patient care services. That's I think the only the mission mode now the government of India taken a digital health as a APTN, Ayushman Bharat, digital, which is covering the all in Java and this health active, and that creates probably it is not only the patient but also the health care provider registry. So this is this is going to create a one platform. That is what we need. The single digital platform is going to help, and that is how we are going to work. If the one hospital is the health record of the patient, that should be accessible to anyone in India. One beauty of this software, this program, health, probably national health, the authority is now going to create all this in putting everything in one health, everyone, so that everybody should, the data should be, there are several issues are there, but, data safety and management. We take care of the national health authority. So, so digitalization of the about the healthcare providers, providing the services to the healthcare recipient, the patient, and in between is the system. We are trying to digitalize. So most important thing at the healthcare setting, transforming into digital platform. So what are the components where we are doing here? E-hospital, health, and that's everybody that target those aspect in the. So e-office, e-health, hospital, in that most challenging thing that we are facing now is the e-prescription. We are e-prescription is when a doctor is seeing a patient, recording this history and transforming into the digital platform history. And when the patient sees, examine a patient and the signs and the symptoms, those things into writing in the electronic no, format and the platform, it is time consuming by the doctors. So there is not much of time to do that. So how we are going, we have gone into the stage of e-prescription. That is the important thing. So that probably it will be a complete digital platform for providing the service to the patient. Everything is digital, no paperwork. So this is the only area where we have to start and we're struggling almost. We are going for it to complete the prescription part because everything. So there are things you can do it by we have the voice that is going to record the symptoms of a doctor's repeating it. So there are many ways. So it is, I think, digital platform making a single account of each and every patient across the world, across the nation is the important thing. Because patient may not have the data or the record of hospital when they go to other states. So when they go to other state with the hospital can easily see their whatever things, whatever treatment, whatever records are generated and seen by the doctor in one hospital, we get transferred into the other hospital. That is the beauty. I think this is a very national the registry, and all the doctors are the I think care provider registry was is for the healthcare provider. They are also recording it in one platform. And there is many things I think if you go for digitalization of the health system to definitely help the health services in the and hospital. So, and the e-governance is one of the important thing. Everything comes in the hospital e-governance or good governance, and this all everything transfer to. So, I hope there are many steps to improve healthcare services by adapting all this digital technology to the healthcare system. Thank you, sir. Thank you for giving me the opportunity to share my views.
Thank you. Thank you, Dr. Biswas. I think you have stressed upon the digitalization. Any questions? I'm sure the panelists will be happy to answer. So if there are no questions, yeah, please. Can you please give mic there?
So in USA there is a MS in digital health, sir, and it's going on for quite a long time. After MBBS, the doctors can do MS in digital health. That would be very good for our country also, sir, because most of the programs, most of the e-learning and most of our statistics all are based on digital health, sir. So we also should, because we have advisor to government of India and government of Telangana, I think we should also try to at least have note prepared for having in our country, sir. MS in digital health, sir.
Yeah, that's what we were discussing. Digitalization, yes, the government of Telangana is quite interested. We have in fact at the Nizam Institute of Medical HMS system and CDAC system.
Post-graduation, sir. It is a post-graduation.
A course, you mean?
Yeah. After MBBS, this MS course is there on digital health in America, sir. And that is a very successful program for last 10-15 years. It is very sort of one of many of our doctors children doing this course, sir. I think that would be very good if we can at least write to our government of India and from Telangana government also, our health universities to have similar course.
Similar kind of a course.
Yes, sir.
Yeah. You want to answer?
Thank you, sir. That is a really great point you brought up. Actually, when it is going towards digital health, uh, the boundaries of doctor, engineer, these kind of career boundaries which do not exist, they exist in our minds. They are blurring. What we saw during COVID was the people who were serving in the hospital had certain ideas and certain experiences, whereas the models that were made by people who could not ever enter the hospitals. There was a large gap. The models were made by people who are tech savvy and in coding, in ML, AI, and are not all those things. So all of us know that there were many models, but none really predicted, nowhere around the globe. And that is where we actually have felt the need for a health force, which is a bridging kind of a force between the medical and the technical careers or lines of working. Because the way a computer engineers or a computer techie's brain works, it's far different than how a doctor thinks. It does not happen every time 2 + 2 4 inside a human body. All of us agree. But for a coder, it has to be so. So the codes or the programs have to be made in such a way that they address medical problems in real time. But do doctors have to learn coding for this? Maybe a few. Need not make the programs, but they can be this bridging force which can tell those who are hardcore techies what we require, what the problem is, so that he can provide a solution. So digital health, when you're talking about a course, yes, these courses are in pipeline. There are IITs across the country who are working towards it, along with the medical Apex institutes for digital health. And digital health has a mix of trainings. So there are some people who are hardcore computer and then AI, ML specialists, along with doctors in various fields. And it's a let's say mix. It's a good combination of teachers, trainers, which can provide digital health training for not just doctors, even computer graduates or engineers who are coming towards the newer futures, the professions which have not existed before, and now they are existing in a big way. These courses are in pipeline. In fact, few of them are already out. We all are working on it, sir. Thank you, sir. Thank you very much.
Thank you very much. And if there would like to add?
Yes, as you said, it's true. When you talk about the digital health, it comes from us only. Whatever they implemented by the government of India, or it may be a government of Telangana or government of AP, almost 156 different programs they are running in a different apps. So every time, whenever we get any type of issues, like a TB program is there, so under Nikshay, so everything we will enter into the Nikshay. Now the real-time data we can do it, the budget, the financing, everything we are doing, and then we are updating everywhere. Even in Telangana, there is a Talli Bidda RMNCH program, and then they're doing it. So every Nikush, and now HMIS data, as sir said, IDSP, IHIP portal, that's the one, epidemiological surveillance, entomological surveillance, so wherever the emergency response. So we are going towards the digital mission programs, and as you said, PM Abhim, under the PM Abhim we are doing Abaka Arts and all these things, Ayushman Bharat programs, E-Sanjeevani, E-Digital. So as sir said, Definitely, and then after the MBBS, if they have a knowledge about the digital health, really it will be helpful to the doctors and as well as to the community. You rightly pointed out, sir. Thank you.
Thank you.
Thank you. I thank all the panelists for a fruitful discussion, and I close the session. Thank you very much.
Thank you. Thank you so much, sir. Of course, it was very wonderful to have different perspectives about the challenges and how to mitigate them. I request the guests to please stay onto the stage. And now, we are joined with our very esteemed guest for the day, Dr. Karthik Adappa, IAS Special Secretary, Public Health and Family Welfare Department, Punjab. Can I request you to please come onto the dais, sir, to give away mementos to our speakers here on the stage. Please request Dr. Anuradha Meadowjuice to please come forward to receive a memento from a speaker. Further, can I request Major Dr. Ashlesha Taude Kelkar to please come forward. May I call upon Dr. Nagari Birappa to please come forward and accept the token of appreciation. Can I call upon Dr. K.V. Ramana Reddy, Dean Mallareddy Dental College for Women, Hyderabad. Can I further call upon Shri Sharad Anand Chupali, MD Shiva Medisoft Services, Hyderabad.